Assalamualaikum and a very good morning to everyone. I am Dr. Yusnida Tajul Arifin from the Department of Restorative Dentistry, University of Malaya. I am here with Dr. Zubaida and Dr. Lin Jisung to prepare for you a teaching video for complete denture. For this session, we are going to show you how to make a complete denture primary. Before we can even start making an impression for the patient, we must, and also before we can even bring in the patient to start the treatment, we must first of all prepare the dental chair. As you can see here, the headrest must be wrapped with a plastic wrap. You also need to wrap the handle of the instrument tray or the bracket tray, as you can see here. Maybe not very clear. Other things that you need to prepare is the instrumentation. We have the examination set here, and also the examination set you have a probe, tweezer, and a mouth mirror. Also, a gallipot containing gauzes here. Another thing that you need to prepare is also a receptor for your dirty materials. And once you have used your gauze, you must throw inside this place here, where it is covered with orange plastic. The handle for the headlight must be wrapped, as you can see here and here, as well as the switch for the headlight. Apart from the other areas mentioned just now, the control panel for the dental chair also need to be covered with a plastic sheet. This area is spittoon area where the patient needs to rinse their mouth. So we have ready here a tumbler which is going to be filled up with water later on. Here is the goggle for the patient to wear. This is especially good for the elderly patients because they may not be able to withstand the glare of the dental light. So this will help them, and this also acts as a protection for any instruments that may fall onto their face. The instruments and materials that is required when making primary impression in complete denture patients are the water bath with a temperature of 55 degrees to 60 degrees. But if you don't have a water bath, you can use the bowl lined with gauze and putting in the hot water there about the temperature I mentioned just now. The idea of putting the gauze over here is to make sure that the compound material do not stick to the bowl. Other instruments, you may need the spatula because you may use alginate also in this stage. Then this wax knife, recron cover, cutter, and an indeller pencil. Also other materials like the compound that we are going to use in this hot water and into the hot water bath. After having done the impression, we must soak the impression in the disinfectant solution. So we need to prepare this disinfectant solution. In this faculty, we use perform, and this is the stick that you may use to hang on the impression, so that the impression will be soaked into the solution. When making primary impression for confidential patient, we need stock trays. This is very important. So we can see here there are various types of stock trays and of various sizes. Usually it comes in small, 3 sizes only: small, medium, and large. And over here I will show you there are a few types. We have this stock tray, which is perforated. This is for the maxillary arch. This is also perforated for the mandibular arch. This one is not perforated, and this is for the mandibular arch, which is not perforated. Apart from that, we also have stock trays, plastic stock trays. Okay, so this is we have grooves over here, so that when we take the impression material will go through the grooves, and these grooves will retain the material onto the tray. Over here is for the mandibular arch. Hello, Auntie. How are you?
I can get
Come, have a seat. Yeah, have a seat here. Okay. It's okay. Okay, how are you today? Okay?
this. Okay.
Yeah. Come, put your head over here. Yeah.
But as I have dropped my medicine, but I have dropped medicine that I dropped.
Oh, okay, okay.
Yeah.
Yeah.
Some tears lah.
It's alright. Yeah. Put your head. Yeah. Okay. You're alright, nah? You must go and put the. Alright. You. Where do you come from?
I come from Sumanjaya.
Sumanjaya. Who sent you here?
My daughter sent me.
Okay, that's good. Then later on, your daughter going to fetch you up, right?
No, I sit past my bed.
Okay. Alright. So you're okay. Today we're going to do some impression. Okay, inside your mouth. So now maybe we want to put the. We must put the apron on the patient, and then we want to put on the goggle, because just in case you cannot stand the light, because it's very bright, because your eyes, so you have some problem. Okay, there. Comfortable? Your head okay?
Okay.
Prior to this stage, you would have already done the thorough examination and diagnosis. You would have taken the patient's dental history, medical history, and also the social history. Nevertheless, before we even actually start doing anything to the patient, we must also check again the intraoral condition of the mouth, just in case there is any pathology, for instance, ulcers and so forth. Okay, Auntie, kita keluarkan denture, take out your denture. Okay. So patient was wearing denture just now. Now we let the patient take out the denture and put it in the container containing water, and then you will check the intraoral condition of the patient. Okay, check the sulcus, the tuberosity area, the soft and the hard palate area, analogy area. So this is healthy, no ulcerations. You also need to check the mandible for any pathology. There's none there, so the mandible is also healthy and the tongue is alright. Now the next stage is to select the tray, the stock tray. Let's check now. Nanti buka ya belum ada. So now we check the tray, the stock tray here, and making sure that the stock tray covers the denture bearing area. On the posterior, it must cover up to the hamular notches. Okay. The anterior, it must cover the ridges. So this tray is okay. We can use this tray for the impression. Now is for the mandible. Check the mandible just now, and now we want to select the tray. Okay. These two, we must make sure that the tray covers up to the retromolar pad. Maybe it's a bit dark here, but you can see that the tray covers up to the retromolar pad. Okay. Over here as well. Okay. Nanti angkat lidah. Okay. That's right. Okay. For this impression material, we have to put in a water bath at a temperature of 55 degrees to 60 degrees. So this is a compound impression material. So you have to break it into half a few and then put it inside the water bath. And this impression material will soften. Okay. So this is a thermoplastic impression material. It will become soft at a temperature of 55 to 60 degrees, and when you take your impression and you take out from the mouth, we will harden. So it is a thermoplastic impression material. So when you use this material, you have to knead it. Okay, this way. Incorporate some of the water inside the material so that the material is softer and it's more moldable. Once the material is evenly soft, we make it into a dough shape, and then place it onto your stock tray and shape it. Shape it nicely, roughly to the shape of the arch, and turn it over to the stock tray so that the impression will stick onto the tray. This way. Okay. And then you need to put back into the water bath for a while. Just for a while. Okay. Shape it a bit and place it inside the patient's mouth. Hati ya, panas sikit ya. Tahan ya, boleh? Okay. Then we press the patient's mouth, and then you can either pull the patient's lip or you can ask the patient to say, kata U nanti, U muncul, U U, okay. Okay, Auntie buka mulut. Okay, move your jaw left and right. Okay, okay, move your jaw left and right. This one, your lower jaw left and right. Okay, alright. Okay, now you need to wait until the material harden for a while. Okay, then can remove the impression from the patient's mouth. Alright. Okay, now we have to check for any overextension or excess of material. We may want to modify the material by removing the excess and then softening the impression material and putting it back inside the patient's mouth. In this case, maybe over this side is a bit overextended. Yeah, this too much material. We can cut this off, soften it a bit, and put it inside. Okay, now we're going to show you how to make a lower impression using compound as well. So the compound has to be kneaded this way. Incorporate some water so that will improve the moldability of the material. So once it's evenly soft, you can then place it on the tray. Shape it this way and place it onto the tray. This way. Okay. Fold it to the side so that it will stick onto your stock tray. Alright. Okay. Make sure the surface is smooth. You can dip it back into the bath. You make a bit of depression onto the compound this way. You put back into the water, then we can then make an impression, making sure that the material is not too hot. Okay, check with the patient. Okay, nanti boleh tak panas sangat Okay. Retract cheek, put inside mouth this way, making sure that the tray is in the middle. Press it home. Okay, retract the cheek. Retract the cheek. Okay, and ask the patient to stick up the tongue. Nanti, okay, jeli lidah ya. Okay, angkat kiri kanan, gerak kiri kanan. Okay. And wait until the material harden. Okay. The impression is now now been washed with water to remove any excess saliva, and then it should be then placed into the container containing the disinfectant. Both impressions are now soaked into the disinfectant for 10 minutes. So we leave here for 10 minutes, and then we will then put in a plastic to be taken up to the laboratory to be poured. After immersing the impressions for 10 minutes, the impressions are now put in the plastic back this way and will be taken to the lab to be poured in stone. This is the completed impression taken. This is the maxillary impression where it covers the denture bearing area. So it should record the labial frenum, the sulcus, the buccal frenum, the buccal sulcus, the hamer notch, both hamer notches, and also on this side the buccal, distal buccal sulcus, the frenum here, and the labial sulcus. As for the lower, it should cover also the labial sulcus, the buccal shaft area, the retromolar pad, the lingual sulcus, the frenum, and the same on this side. So you have here, you can see it extended up to the retromolar pad. For the primary impression, we need not record the details just as yet. We only need to record the denture bearing area.